And we welcome from Old Dominion University Dr. Jim Blando. Now, Dr. Blando is the chair of epidemiology, biostatistics, and environmental health at ODU, with research on air quality trends and the impact of wildfires on asthma and environmental related health concerns. Dr. Blando, reading your biography off here, I don't think there's a more perfect person to talk to today than you with the situation that we've been observing outside. I just want to start here. Your reaction to what you're seeing as someone who studies this, as you go outside and observe what we have going on in our area, just what's sort of your first impression?
Well, my first impression is that it's a significant public health issue that can certainly impact the health of individuals, especially sensitive individuals who have conditions like asthma, COPD, any kind of cardiopulmonary, any heart or lung condition. I think can be very susceptible and sensitive to these relatively high levels of smoke that we're actually seeing in the atmosphere, which is across a wide region of the United States, the northeastern part all the way down to the southeastern part. So my first impression is that this is an important issue. This is why EPA's Air Quality Index has been published and is utilized. Right now in Hampton Roads, I think I just looked on airnow.gov, which is EPA's air quality website, which has great information on it. And the air quality index for Hampton Roads is 180. The air quality index for Charlottesville is 234. And those are quite high levels. When you get above 100, you're above the ambient air quality standard. And those are significant levels that, in fact, I think we're in a code red here in Hampton Roads. And code red essentially means sensitive individuals should stay indoors and limit outdoor activity. And even some healthy individuals may experience some problems when you're in a code red range. So it is a significant public health issue that is important.
And when we say, those numbers, 170, 200, 180, I apologize for the naivete involved in this question, but that is 170 what exactly?
So you can sort of think of it like this. It's basically the percent of the ambient air quality standard. So for example, if it's 200, that means we're 200% of the ambient air quality standard. So if the ambient air quality standard for fine particles, which is what we're talking about when we talk about smoke, is in the United States, it's 35 micrograms per cubic meter. Well, if the air quality index is 200, then that means it's roughly that what they're measuring out there is 70 micrograms per cubic meter. So it's double what the acceptable air quality standard is that's been set by EPA. So that's what it's kind of, think of it as a percentage of the air quality standard.
Okay, perfect. And when we talk about those public health risks, I want to focus on people who are not experiencing upper respiratory issues at this time, people who are kind of going outside in general health. What type of impacts could they experience from prolonged exposure outside to our current circumstance?
Yeah. So a couple things that we know. We certainly know that even healthy people, when they experience high levels of smoke or fine particles, what we oftentimes refer to as PM 2.5, the 2.5 really refers to the diameter of the particle. It's a very small particle, 2.5 microns in diameter. So even for healthy people, they're very likely going to experience some, perhaps eyes feeling irritated, nasal passages feeling irritated. A lot of times healthy people, even if they don't have asthma, they might say, the air feels kind of heavy and it might feel a little harder to breathe and exercise, and it might not really feel like jogging very much outside because although I'm healthy, I don't have any of these pre-existing conditions, the air quality is just really bad. Now, one of the things that hasn't really been fully accepted by the research community, but certainly an area where we're doing research at Old Dominion University, is that we think wildfire smoke actually serves as a sensitizer to allergens so that it can enhance your allergies and make your allergies worse. Now, that's something we're actively researching on. I think there's some information, and we've published some papers that sort of suggest that. I think we have to do a little bit more work to actually see if, in fact, that is true or get the nuances of that relationship. But I do believe that not only is it a respiratory issue for conditions like asthma, I do think people that have allergic rhinitis, which is allergies in your sinuses and your nose, I do think it'll impact that as well, because I think the wildfire smoke is full of allergens and will sensitize you. In fact, we did some studies that we published back in 2022 where we took allergy clinic patients and we found that the dismal swamp fires that occurred in 2008, 2011 down in North Carolina back then, which is a long time ago now at this point, but we found that allergy clinic patients were still experiencing symptoms even for a year after the wildfire was put out. And a lot of people say, well, how could that be? The wildfire was put out. And we just sort of remind people that what we think is going on is that the wildfire smoke, which has got a lot of allergens in it, is sensitizing you to your allergies and making your allergies worse. And it takes a while for that to dissipate.
So this could potentially be a longer term problem if there is overwhelming exposure.
Well, we're still doing research on it, but yeah, we're thinking that that's something worth researching, that it could very well be that, after the wildfire's been burning at Dismal Swamp, the wildfires burned for about 6 weeks before they were out. And for that length of time that people were still experiencing allergic symptoms all the way up until a year after the wildfire was put out. So yeah, we still have work to do, but I think a lot of us are thinking that in fact that could be a reasonable assumption based on the data that we're seeing.
And something that maybe is more anecdotal, but I want to ask you about, and maybe speaks to human nature more than the particular areas of study that we are discussing. But I'm imagining that you have general conversations about this based on your area of study. I have more so than with a thunderstorm or a hurricane. I have people in my life who are aware of the warnings that are out, but are not particularly concerned about this. I'm wondering if maybe you have a handle on why that is. What is it about this weather phenomenon that people seem more willing to look past it and just keep living their normal lives rather than heed sort of precautionary advice?
Yeah, I think there's a number of things. Unfortunately, there's a lot of misinformation out there about climate change in general. I think there are a lot of voices, well-funded voices out there that spend a lot of time trying to tell folks that climate change is not an issue, when in fact the data speaks very clearly otherwise. And we always just encourage people to look at the data, but I think that's one reason why people might sort of dismiss it, because they hear a lot of these voices that are saying climate change isn't an issue. But we know very clearly, especially when it comes to wildfires, if you give any honest interpretation of the data and objectively, without bias, look at the data, it's very clear that the number of wildfires is increasing, the frequency of wildfires is increasing, the amount of area burned in wildfires, the wildfires are getting larger, and the mechanism that seems very reasonable is that, in fact, we have extended periods of drought, and sometimes we have extended periods of extreme flooding. But the drought periods really prime, wildlands to be very susceptible and very good fuel for fires. And that really increases the problem. And we see that. We see that very clearly in the data. So I think that's one thing that impacts people. There's some misinformation out there that sort of dismisses it, even though it's I oftentimes say to my family and friends that, you can't dismiss what you see with your own eyes. So I just kind of leave it there. So I think that's one thing. I think that I think another thing that is really surprising and kind of counterintuitive about wildfires, and when you hear about deaths in wildfires, one thing that is very surprising is the National Fire Lab out in Montana did some studies where they looked at the speed at which the front of a fire will move. And it's very counterintuitive, but when you actually look at the data and you look at some of the very dramatic video, which they used to have posted on their website, it might still be there, it's amazing how quickly, when the conditions are right, a fire can spread, especially if it's very windy and the embers are getting blown all over the place. And I could totally see where, intuitively you'd see a fire off in the distance and think, wow, that's really far away. That's really not going to impact me. But you don't realize that it can move. I saw one video where it moved, it looked to me to move about 100 yards in a few minutes, in a couple minutes, if the conditions are right, that is, with the wind blowing and the fire burning and so on. So I think that's another, I think there's some things about wildfires that are kind of a little counterintuitive. And if you don't normally work with wildfires or experience wildfires, it does seem like, oh, that's kind of far away. That's really not a big deal for me. And I think sometimes they find that that can be a reason why people sometimes can be very delayed in when a fire is moving into their area where maybe they don't move. So I think that's another reason for human behavior, is that there's a level of it that's kind of counterintuitive. I know even for myself, I know I have that natural inclination to think, boy, that's really far away, even though this is what I do for a living, because I know from seeing the stuff that the National Fire Lab has done that some of these fronts under the right conditions can really move fast. So I think that could be another reason. Wildfires are really, it's a difficult problem. The firefighters have a really tough job, putting this out. And I think sometimes, and certainly some of our colleagues that deal with, perceptions and human behavior would probably tell you a lot more than I could. But I would imagine there's an element of denial sometimes to these issues. But certainly, and then I guess the other thing is, wildfires are fairly episodic. So, we've had a long couple months without any smoke in Hampton Roads, and now all of a sudden it's very smoky, and these fires are not going to be out anytime soon. They're probably going to be burning for the rest of the summer. And what's going to predict whether you get smoke in your area or not is what the weather patterns are like. Is the smoke blowing in your direction, or is it blowing in the direction opposite to you? If it's blowing in the opposite direction, then you're not going to experience any smoke. You say, oh, everything's fine. But all that has to happen is the wind direction has to change, and now it's blowing in your area, and you say, oh my goodness, this is horrible. I know today I got up and my neighbors and everybody said, oh my God, can you really smell that? And it's like, yeah, you can very much smell it. And this is from fires that are hundreds of miles away. So I think those kind of characteristics can lead people to sort of dismiss the issue a little bit. And I think that contributes to it. And I imagine there are others, and I'm sure if you talk to people that study behavior of, human behavior, they probably add a bunch of other things. But those are some of the things that I would think about.
Yeah, and my colleague here in studio, Nia Campbell, and I were talking about the smell in particular. I could not believe how strong the smell was, that I could even notice it when I went outside today. Now, you talk about the rest of the summer, and a lot of things will depend on wind patterns. So am I to believe that this could dissipate over the course of the weekend, and then on August 10th, we could see the reemergence of this haze?
Yeah, sure, absolutely. It all depends. It depends on wind direction, both the horizontal wind direction and also the vertical wind direction, because the vertical wind direction is going to impact how it dilutes and gets dispersed in the atmosphere as a whole. But yeah, it's going to depend on the wind directions. If it rains this weekend, that'll wash particles out of the air. Rain can be a very good way to sort of wash the air, if you will. It'll wash the particles out. But if the wind direction continues to blow smoke in this area, the rain will wash the particles out and the smoke will move back in. So it will be very variable depending on the specific wind directions. When we had the Dismal Swamp fires here in North Carolina, back in 2008, 2011, it was if the wind was blowing to the south, it would blow that smoke away from us and everything would be crystal clear. And then the next day, if the wind direction switched and came back, blew the wind north to the north, what would end up happening is it blow the smoke in our area and it'd say it'd be horrible. So yeah, so it's, and wildfires are hard to put out. Some of these wildfires, as I understand it, are in fairly remote areas in Canada. And sometimes these wildfires, when they get going, they are very hard to put out and they will oftentimes burn for weeks on end. So yeah, absolutely. It could rain this weekend. The wind blows in the other direction. Everything's clear and seems fine. And then all of a sudden on August 10th, the conditions are right and it blows it back in your area and you got the same thing all over again.
And, a situation where obviously this is impacting us, and we live in an ecosystem where the Chesapeake Bay dominates so much of our livelihood, our commerce, our recreation, the Atlantic Ocean as well. Is this something that could impact water quality? Is there a danger there?
Absolutely, because everything's got to go somewhere, right? So when it rains, it's going to wash those particles out. Where are they going to go? They're going to go into the bodies of water that rain's going to run into. So absolutely, it can impact water quality. It can impact soils because there's something we oftentimes refer to as deposition. So air pollution and particles in particular will settle out. Now these particles are very small, so they can stay aloft for weeks. But there are various processes in the atmosphere that will remove those particles, and they will deposit somewhere. They'll deposit in water. They'll deposit on soils. So it absolutely can impact. Now, one other thing that is interesting is that when you have a pure wildland fire, where it's just but when you have a pure wildland fire and it's a forest that's burning, what is burning is going to have a very big impact on the chemical composition of the air pollution generated from that. In LA, when they had those massive wildfires in LA, because they were burning communities that had lots of manufactured goods and things like plastics and metals and batteries, that impacted the composition significantly of the wildfire smoke. And there was definitely a significant toxic component. However, as I mentioned, even wildfire, even smoke generated in a pure woodland fire will have plenty of other toxic materials in it, as well as allergens and other things. So, the situation with a wildfire, and a lot of our engineers would probably tell you, a wildfire is not a really well engineered designed combustion system. You get a lot of smoldering and smoke, which generates a lot of what we refer to as products of incomplete combustion. If you don't burn something fully, you're going to have those allergens and those chemicals and those other things in the smoke coming from it, and those oftentimes have varying degrees of toxicity.
Now, I would imagine based on that answer that the answer to my next question is going to be yes, of course. So the question is, how could this impact crop production and the farming industry in the areas where the haze is a real problem?
So, I don't know how well that's been delineated in the scientific literature. Certainly, it impacts the amount of sunlight that reaches the ground. In particular, it can impact the acidity of the water and the soils. So that can have a significant impact on both the fish that live in that water, the body of water, and the crops that are growing in the soil. So that's a very good question. I'm not familiar with much research that's been done in that area. However, it's definitely reasonable to think that it can impact the pH potentially, depending on what is in the smoke, and certainly if there's a lot of sulfur in the smoke, it'll make it more acidic. And if that impacts the pH, that can definitely affect crop growth as well as the toxicity to fish and things that live in the water. So, okay. But it all depends on how much, for how long. It depends on, Chesapeake Bay is a very big bay, so there's a lot of dilution. So it'll depend on what kind of concentrations you would see and those other factors that you'd have to measure to have a really good estimate.
And maybe a worthwhile follow-up for us here at 13 News Now, as we get past this situation, perhaps reaching out to some farming groups in the area and seeing if this did in fact impact them. Another thing that I think everybody tends to worry about in these extreme situations, obviously you want to keep your family safe, and that family oftentimes can include pets, especially when it comes to dogs who need to get outside, need to go for walks, need to be outdoors. Any advice for families who have pets that they are looking to keep safe?
Yeah, so generally what we often tell people is some of the same things you would do as a human, you would do for your pet. Of course, one of the differences is, your pets are going to have to go outside for a walk or to go to the bathroom, for example. So, but what you would probably try to do in that situation is limit that as much as possible. That's within reason and that's practical. And, we typically EPA's advisory for AQI levels at 180, like we're seeing right now in Hampton Roads. Say try to stay inside as much as you can. If you have high efficiency filters in your HVAC, your house air conditioning system, that's probably a good thing. Scientific studies do show that HEPA filters, they say high efficiency particulate air filters or HEPA filters, or high efficiency filters in those standalone devices, as long as you get a device, it'll say on the box, it'll say for what size room this device is designed for. As long as you match that up well, they can do a very good job of cleaning the air inside your house. You have your windows closed, you have your air conditioner running, you have these HEPA filters going, and that can do a very good job of cleaning the particles out of the air in your house and really dramatically improve the air quality in your home, as well as the whole house air filter. When you put it in your HVAC system, the whole house air filter that you might put in on your return vents in your HVAC system. One thing we do discourage people from doing is electric clarifiers, air filters that use electricity to clean the air. One of the things you have to be careful about is, depending on the voltage that's used in the device, the arcs can sometimes generate ozone gas. And if that were to happen, ozone is a strong irritant, and you could be kind of, trying to solve one problem and create another. So we encourage people to investigate that if they were going to buy one of those devices. But our advice is generally just go with the standard regular HEPA filter, high efficiency filter, and just make sure it's sized properly from the room. And that can have a really good impact on your indoor air quality when you have one of these events going on outside. Because some of the outside air, as you know, is going to infiltrate inside. So you'll get a little bit in your house too as well. So you put in these HEPA filters, and that tends to do a very, very good job.
And then so much of the reporting that we have seen is based on the air quality in major metropolis areas. Now, of course, that's a natural place to take that reading, right? And it maybe speaks to the surrounding areas. I'm wondering, with the amount of pollution that already exists in major metropolises, does this become does the combination of those things create a worse condition for maybe New York City as opposed to a smaller city that is very close to New York and would likely have the same impacts from the fires, but maybe doesn't have a current air quality, system that's already sort of, needs work, I guess, if you will. It's a really poorly formed question, but I think you understand kind of what I'm getting at.
No. I totally get what you're asking. So one of the things that's interesting about air quality, for those of us that do air quality, the challenge with air quality is we have to breathe, and you're surrounded by the air, and you have to breathe that air that you're surrounded by. Sometimes if you have a water pollution problem, I can go buy bottled water, but with air, you can't do that. Now, air, we have one atmosphere and it's all connected. So this smoke we're seeing here in our region, it's pretty amazing when you think about it, that this smoke is coming from hundreds of miles away, like really far away, because we have this long range transport. So what's really intriguing about it is that because we have one atmosphere and it's all mixed, and things spread and they get diluted, that's for sure. So they're usually higher concentrations closer to the source. But the reality is, if I have a small community that is near a major metropolis, the smoke is probably going to be pretty similar in both the big city as well as the small community, because that air is all connected. So a small community can have a problem. They may have less resources, for sure, to deal with those problems or measure and have the awareness of, hey, what is the concentration out there? But they will likely have very similar concentrations to the areas that they're nearby. And then as you get further from the source, I think what you'll find is you may have some dilution occurring. So you might get smaller levels, but just remember the air is all connected. It's all one atmosphere. So that's how we get this long range transport, and where you can have communities that are fairly rural, don't have a lot of sources of air pollution, have poor air quality. You say, how could that be? Well, there's nothing there. And you say, well, that's because air is getting transported in from somewhere where there are sources that are impacting the air quality.
Right. Okay. Got it. And you mentioned the bottle of water. I did think of a potential facsimile of that bottle of water for a situation like this. Now, have you ever seen a football game where a defensive lineman happens to catch an interception and then they run it back into the end zone, and then when they get over to the sideline, they immediately go for the oxygen? They immediately go and they get the mask and they've got the tank there. That could be like a bottle of water for a poor air quality situation.
Yeah. Well, it's funny you mentioned that. I've seen a couple. I think they're honestly more to humor folks, but there are places around the world. So I spent some time in Central Asia studying air quality, and there's some areas in Central Asia that have really, really, really bad air quality all the time. And there are people there that will sell bottles of clean air. But the problem is it's expensive to do that, and you run out pretty quickly, and it's really not feasible. But of course, we do have, oxygen generators and things that are used in medicine for people with serious illnesses. But I guess, it's always that question of the practicality, the expense and practicality of doing that. Some people may wear N95 masks, and N95 masks will filter out the particles before you breathe them in. They can be very good. It's just that not everybody can use a mask. It all depends. Somebody with a serious heart or lung condition would have to ask their healthcare provider if they would be able to wear that safely. But for a healthy person, some people do wear those masks, and they can be helpful as well. You just have to make sure that you're fit enough to actually wear one of those masks.
And my last question for you, beyond the masks, which you've just discussed and we've talked about quite a bit, beyond my relatively unfeasible idea of personal oxygen tanks, beyond staying inside, is there any other remedies that people can take when they need to live their lives, they need to be outside, but they want to be as healthy as possible, and maybe the mask isn't an option that they love?
Yeah, so one of the options for this would definitely be those HEPA filters that you can put in a room. I've seen people utilize these HEPA filters in offices when they're at work. You may have, ever since COVID, you may have noticed that some of your healthcare providers will have these HEPA filters going in their exam rooms, because, infectious diseases that somebody might sneeze out, they want to get those filtered out and so on. So that is one thing that can be a practical option. Is you don't have to do anything. You get the HEPA filter set up, it's sized to the right size of the room, turn it on, and you can run that while you're at work, and it'll filter and clean the air for you. So that could be a feasible thing to do. Certainly in your automobile, as you know, your air conditioning system runs the air through a filter before it distributes it to the cab, or it should run through a filter unless you took the filter out, but should run through the filter. And so you're filtering your air there. Keep your windows closed. Put your air conditioner on while you're driving in your car. So you have as much time as possible with some filtered air, which will hopefully clean it up. I think that certainly if people are experiencing medical issues, they should go see their healthcare provider or go to a healthcare facility for sure. If people have asthma or experiencing issues, even if they have no known issues, if they feel like they're experiencing a respiratory or cardio issue, they should go see their healthcare provider. And probably the only other thing that we could demand as citizens is that we want environmental protections, and we want climate change and some of these issues addressed from a policy standpoint, because as I said, these wildfires, looking at the data right now, significantly suggest that these wildfires are going to increase in frequency, length, and size. So there are people out there that are studying this very carefully, and there are some interventions and things we can do that can help to reduce the risk. There are some definitely forestry practices that can be utilized to try to reduce the risk of fires and the size of fires and so on. And I think if people want that from their policymakers, they should demand it.
Yeah, perhaps a catalyst for more proactive solutions to prevent this from happening again. Dr. Jim Blando from Old Dominion University, what a pleasure. We really appreciate you coming on today.
Great, well, thanks for having me.
Yeah, this has been great. We know you're probably in incredibly high demand on a day like today. So thanks for taking some time with Live Impact News, and we'll hopefully catch up with you down the road.
Great, appreciate it. Thanks for the opportunity. Nice talking to you.